third-party liability. What is it? Who manages it? What information is required? Why is that information required? Who should report TPL information? We'll talk about using that online web form, reporttpl.org. We'll talk about the health insurance premium payment program, run through FAQs, and talk about other resources moving forward. So I'm Colette Bird. I'm the Community Partner Outreach Programs Provider Campaign Coordinator, and we're with Member Services at the Department of Human Services. And with me in our room is our TPL expert. I'll let her introduce herself.
Hello, everybody. This is Carolyn Siebes. I am the third-party liability policy analyst for the Office of Payment Accuracy and Recovery. One of the units that I provide technical support to is the health insurance group. And I've been with OPAR in that position for almost 10 years now. So hopefully I'll be able to answer any questions you might have today, and we'll be able to provide you some information that will be useful for you going forward. So happy to have you all here.
Thank you. So some quick housekeeping items. You've probably noticed by now you are on mute. We are going to keep all attendees on mute since we are recording this webinar. Please type your questions into the webinar chat field. We will try to break for questions throughout the presentation. And if we're unable to answer your question, we will follow up via email. And in your handouts, so if you go to the right-hand side of your webinar, you should have a little section where there's handouts. You have a copy of these slides, as well as the Health Insurance Premium Payment Program Quick Reference Guide and the Health Insurance Group Quick Reference Guide. So those are available to you moving forward. And you can just drag and drop those onto your desktop. Okay, so let's jump right in and talk about third-party liability. Third-party liability is also known as other health coverage that's available to those that many of you help navigate the systems in their application for Oregon medical assistance, such as Oregon Health Plan. So examples of third-party liability include employer-sponsored insurance, COBRA, student insurance, commercial health insurance like Medicare supplements, dental insurance, vision insurance, and also includes health insurance available through a spouse or parent, even if they live outside of the home. And there certainly may be other examples, but these are the main ones that we see.
So who manages third-party liability? Right now, all of the TPL, and actually for many years now, all of the third-party liability actions that are necessary to keep MMIS updated and running as intended are all performed by the Health Insurance Group. This is one of several units that are with the Office of Payment Accuracy and Recovery, or OPAR. OPAR is a shared service between the Department of Human Services and the Oregon Health Authority. Technically, we are under the DHS umbrella, but as a shared service, it means that we provide assistance to both entities. We have a website address on here for you of the OPAR business pages. So if you want more information about OPAR, you can go there. You'll find our fraud unit there and medical payment recovery unit, client maintenance unit, lots of our 11 units. There's information there on all of our 11 units. So that could be a good resource for you in the future. So what is third-party liability? Really, in the list that Colette gave earlier in the previous slide, it shows lots of things that are potentials to be third-party liability. You know, TPL really is other payers that could be responsible to pay for Medicaid claims or health services, excuse me, that clients may be receiving. We don't need to have everything reported to HIGSO. There's certain things that do have to come in and certain things that don't have to come in. So you do not ever have to report to us anything that's Medicare related. We get that information on a weekly interface, if you will, with the Social Security Administration. So anything that is Medicare A, B, C, D, or Medicare Advantage plan, you don't have to report that to us. We get that automatically from from SSA, which is great. You do not have to report Medicaid if it's out of state. We don't need to have that in MMIS. And you don't need to report homeowners or auto insurance to us, even though those are most definitely types of third-party insurance. We may at some time need to get that information from a client. A provider especially may be required to bill personal auto insurance that someone has. If they've had an injury, the billing of the PIP insurance, that may be something that a provider would have to do. But for the most part, what we do want you to report to us are those types of insurances that people purchase and those types of insurance that are supplied by an employer. So that list that Colette gave you, I think on slide, what was it, slide 7, would be a good one for you to refer back to see if the type of insurance that you're considering is one that needs to be reported to HIG.
And real quick, the slide does say that these types of TPL do not need to be reported to HIG, but must still be reported on the OHP application and in the One Applicant portal. Yes. And the one exception to that is homeowners and auto insurance. We aren't reporting that on the OHP application, so that's slightly misleading there. The first 2 examples, though, yes, you would be reporting those on the OHP application regardless, because they may affect eligibility. So let's talk about why TPL information is required. First of all, federal regulations require that we collect TPL information both at the initial application for medical assistance like OHP and at recertification or at renewal time. It may also, like I just stated, affect the eligibility for OHP for children and teens. So many of you I know are familiar with the Children's Health Program, or excuse me, Children's Health Insurance Program. And that is kind of a funding level under OHP for children and teens for households with an income of 138 to 305% of the FPL. And in most cases, children under 19 in these households are not able to have other major medical coverage in addition to CHIP. So if they were enrolled in other major medical coverage, they would be denied in most cases for CHIP. It also impacts the way that OHP providers bill. In most cases, TPL acts as the primary payer for the member, with OHP as the secondary payer. And finally, with clients who have active major medical, which is the type 1 TPL, are not enrollable into a CCOA, which is physical, mental, and dental health, or CCOB, which is physical and mental health. And just to point out, what we mean by type 1 TPL is like the full meal deal, covers physician services, hospital labs, x-rays, and pharmacy benefits.
So what information needs to be reported? I want to run through this list, and I think it maybe would be helpful to tell you this in advance. And Colette, you and I did not talk about this, but I think it would be helpful for our attendees today to know, is that once third-party insurance is reported to HIG, what they have to do is they have to contact the insurance company. And we have a very specific set of information that we have to give the insurance company, and then with that, hopefully the insurance company will release back to us dates of coverage and other data that we need to be able to update it in MMIS. So nothing that comes in is taken as gospel. It all has to be verified. But before we can even have that conversation with the insurance company, there are key pieces of information that we have to have, or we're not able to save the work, update MMIS and save the work. So I think it's important that you know that HIG doesn't ask for information that we don't have to have, and everything that we ask for, we do have to have in order to make that connection with the insurance company. So some of those pieces, or those pieces that we do need to have reported, is obviously the name of the insurance company and how to get a hold of them. Blue Cross is a great example, and some of you may or may not know this, but we have Blue Cross of Oregon and Washington and Tennessee and Idaho, and pick a state and there's a Blue Cross for it. So we would need to know Blue Cross of what state and a contact phone number for them so that we can be able to do that verification. We need to know the policy ID and the group number, the policy type if we're calling on a medical or a dental policy. We need to know most definitely what the status is of that insurance. And the reason that we need the status for the active dates, the start dates, and the policy end dates is so that claims pay and deny correctly. We don't want to have MMIS deny a claim if the TPL has already ended and it's something that we should have paid or a CCO should have paid. So it's very important from a claims payment perspective that those dates be accurate. Now, do you always know exactly when it starts or stops when you're filling out the web form? No. But you should know if it's active or if it's terminated. And we just tell folks, try to get it in the neighborhood. If the insurance was from 10 or 15 years ago, it may be something we don't even want to add. But if you can tell us it terminated this year, last year, and actually anytime in the last 3 years, we need, that helps get us in the ballpark so that we know what type of policy or which particular policy we're trying to verify. We need to know whether it's employer-sponsored, where it came from, and how they're paying for it. Those are useful for us for the HIP program, which we'll talk about later in this afternoon's presentation. And we most definitely need to know who the policyholder is. I could not call Blue Cross, for example, and say, hey, I've got this lady that works in this department. Can you tell me what her insurance is with you? If I don't say it's Colette Bird, then we're not going to get very far. So we do need to know who that policyholder is. The Social Security number and the date of birth. The date of birth helps us find the right policyholder or the right person, and the Social Security number, if they have one, is something that the insurance payers, the majority of them, are still requiring as a check to see if we're legitimate in the request that we're making of them. We also need to know who's covered by the insurance. Believe it or not, we have a lot of families in our MMIS system right now who aren't represented as having insurance, that maybe at one point the mom got reported or one of the kids were reported and then a new baby came. And mom never thought to call and have the new baby added. So what that causes is a disruption in claims payments. So we really need to know as many people who are on Medicaid, who are in that household, who are covered by that insurance, all of those people would need to be reported. Let's talk a little bit now about good cause. Good cause is a really critical part of the business that all of us do. We obviously want our clients to be safe, and we also want to make sure that they can use the insurance that has been provided for them by their parent or their absent parent, or in many cases it's a grandparent that's doing it. But sometimes there's good reasons why we don't want to pursue. It's a decision the state makes not to pursue that insurance, and generally it's a safety issue. I'm sure many of you know that when you use your own insurance, at some point after you use it, you get a paper in the mail that says, this is where you went, this is the service you got, it's got your address on it, it has claim information. That's called an EOB, or an explanation of benefits. And it always goes to the policyholder, not to the person that necessarily got the service. And so with a good cause, with safety, we want to make sure that we aren't sending EOBs to policyholders if there is a threat to their safety. Clients are asked at applications if the TPL can't be accessed due to safety or other reasons such as distance. A great example of distance is Kaiser Permanente. So I think most of you probably know Kaiser's available in the Salem area, in the Portland area, but it's not in Baker City, it's not in Klamath Falls. That's a long way for someone to have to go to use that insurance. So we do have the ability, when someone can't access the insurance due to distance or due to safety, HIG has a way, we still add the TPL in the system, but we have a way to code it so that it is not seen by a provider. I like to call it my Klingon cloaking device. It just sort of hides it in there. And so when a provider goes in and checks the web portal, they might not see that insurance, and then they would just bill us on fee for service. When we add good cause, and this is something we get questions about all the time, but when that's added, that person gets their benefits on an open card or fee for service. We have no power to tell them, yeah, we're going to add the good cause, but now you can't use your insurance. They could choose to use it if they wanted to. It's theirs, they're covered by it. We can't tell them you can't have it. So they get their services fee for service, and they are not enrollable into a managed care plan because the TPL technically is still active. So you report it, HIG adds it, the Klingons hide it, and the providers can just go ahead and bill. So hopefully that explanation makes sense to you. If you have any questions for that, so please go ahead and just send them in. What HIG does in that case is we just add a TPL exemption on them, and that is what prohibits the enrollment into the CCOA or the CCOB. But we do, in some cases, especially through the child welfare system, they do have the ability to go ahead and still add a enrollment for mental health or for dental. So that's an exception that is available right now if that's needed. So hopefully that explains good cause to you a little bit. Oh, and to request good cause, I think I should add, that usually should come from a worker through the application center. DHS or OHA can request that. We don't take requests for good cause from providers or payers. So if you think you have a good cause situation, then you could contact one of the branch offices and ask them to look at that. If there is a safety issue with good cause, there may be other services that a client may need, and the branch should be aware of that. But generally, HIG adds good cause to cases because a client has asked for it at application or because it's come in from a caseworker at some point down the road.
Mm-hmm. And then to add, and that includes branch 5503, which is our main processing center. So most of you who are assisters, application assisters on this presentation today, you know that on the application it does ask for that information, both on our paper and PDF, as well as in the one applicant portal. So there is, that information is being collected, and that is the best way for application assisters to help members report that.
We do, I want to make you aware too that not every request for good cause is actually approved. Example, we had someone ask on an application for good cause from Kaiser Permanente. They lived in Beaverton, and they were the only person on the case, and they were the only person on the insurance, and they asked for a safety good cause. So you can't really ask for good cause against yourself. So there really wasn't a threat there to that individual from someone else because they are both the covered person and the policyholder. So that individual may have been confused about what that part of the application meant. But for the most part, if it's about safety, those are just approved. We do make some communications with the branch offices to let them know that that's happening. So you have to have a logical approach to that. If someone is living in a Kaiser Permanente and they're living in Salem, they don't really have a distance issue. So there has to be some thoughtful process in working through what that request is really for and whether or not they truly qualify.
So I think this would be a good time to take a moment and just take a look at questions that are coming in. As I mentioned, some questions we will answer via email after the fact, but if we're able to answer them right now, we will. So hang tight.
Applying for what service? So that she's talking about applying for good cause?
So Priscilla, if you could maybe restate your question. You asked, what about crime victims if they are applying for that service? If you could just restate, unless we answered your question, but if you could just restate which service you're referring to. Is that right?
Yeah.
Okay.
Okay, so the next question is, are the people who process applications doing entering of TPL? That could be, depending on if a client is calling in to 5503 to have some assistance with having the application completed just in general, that person may enter that TPL in for them. I think really anybody who is applying for benefits, either for themselves or for someone else, whoever is in that applicant portal or is on that federal application or is filling out that paper application, I mean, anybody can enter it. Obviously, you want to make sure whoever's entering it, if someone is helping you, that person that the client is actually providing the correct information, because the information is only as good as what someone is telling them. But anybody filling out an application can help enter the TPL information. I mean, hopefully that answered your question.
Yeah, and while the application does collect some of the necessary information for TPL, we do train our assisters to also help the member submit information through reporttpl.org, and we'll talk more about that online web form and that process, as well as who can report through that form as well.
So the next question's a good one. In fact, Colette and I were talking about this before we started today. Often the dependent does not have the policyholder's Social Security number, and we're aware of that. So what we ask everyone to do is we want you to do your due diligence to try to get it. There's a difference between not having it, not having a Social Security number, between not wanting to give it or not wanting to take the effort to get it. Keep in mind that whatever pieces of information we don't get that are mandatory in that web form, we have to go try to find it, which is a delay. I started my career at 5503. It was way, way back in the day, 20 years ago. And I remember there used to be kind of a philosophy out there, well, just send it to HIG. They know how to get this stuff. And that's just not the case. So HIG struggles with trying to get information the same as all of you do. And we know that you work really hard to try to get that for us. If you've done your due diligence and you've tried every way you can to get that number and it's just not available, I'm going to give you some direction, but I want you to not promise us and yourself that you won't take advantage of it. You can put all 5s in that space.
And that's in the web form, not on the application.
Oh, yeah, not on the application. Thank you, Colette. I appreciate that. On the web form, you can put all 5s, because we still want you to submit. That is a mandatory field, and it will stop you from going forward. So if you get in that jam, just put in all 5s. It will help you move forward. And then maybe in the comments box say, sorry, I had to use all 5s because, and then explain why you were not able to get that. That will help HIG know where they can start their search, because the insurance company is going to require it from us. So
yeah, and that rings true as well for folks who don't have a Social Security number, who do have TPL, to go with that guidance, but then explain in the comments section that they don't have one.
Yes. That will all help us. It's a team effort here to try to get that information so that we can move things forward. Okay, so regarding newborns, does HIG reach out to the parent to ask if there are other insurance for their child? Fantastic question, Wendy, and the answer is no, we don't. HIG is a very small unit. It's what I call a reactive unit, which means we only take actions when someone brings to our attention that we need to. And there's just not a good way for us to know when those newborns are here and to do that follow-up. My experience with newborns, frankly, is that that's probably one of the most missed opportunities that we have. And that really needs to be stressed as you're working, as the providers and the assisters are working with pregnant women. Make sure that they know that that really needs to be reported as soon as that baby is born. Because once the baby gets in, if you send that web form into HIG, we'll get them on the system right away. Most babies with insurance, about the first 30 days is covered. And then after that, then we've got some different issues going on. So yeah, no, HIG does not do that at this time.
So follow up, if a patient is a victim of a crime and has Medicaid or is applying for Medicaid, does that need to be reported?
Victim of a crime. That to me, it's a TPL, no, unless of course they happen to have insurance and the normal rules apply. OPAR's personal injury liens unit does have a component that works with restitution. So if that person has been a victim of crime and restitution's been ordered, that may be a question that you want to contact the personal injury liens unit about, and their contact information is on that link we gave you right at the beginning of the webinar. But that's a good question, Priscilla. Thank you.
And then question, can you please repeat the process of asking for good cause? The only branch that we would be working with is 5503, Susan's an sister. And anything about TPL, they tell us to go to the HIG webpage. Okay, so that's half good information. So I'm glad they're telling you to go to the HIG webpage. That's very good. Actually, Susan, thank you for bringing that kind of to my attention. That would be a good thing for us to add to that HIG webpage. I'll take a note on that and see if we can't get some instructions on there about asking for good cause. What you could do is call the 800-699-9075 number for 5503 and then tell them that you need to ask for good cause, and hopefully one of the folks that is answering the phone on the call center, they should be able to get you connected over to make that request. If not, you might ask for one of the leads, but I'll tell you what I'll do, Susan. We'll take a note on that, and let me actually, I'm meeting with 5503 right after this webinar. Let me run that past them and see what their thoughts are about that, and then we can send that out to you in an email early next week. Hopefully that would be an okay solution for you. So thank you for asking. That's two opportunities we have there. So we have a question that says, we assist a lot of Job Corps students with private insurance. I'm guessing that's what you mean, Alex, when you're saying PI. Most of these students do not have a good relationship with their parents, therefore they're not at home. Is there an exception for them?
Not unless they are not in the area. Unfortunately, the federal regulations are that we have to pursue that insurance. We could look at it on a case-by-case basis. I would say, as there's just a big process in place because someone's in the Job Corps, no. But if someone was in the Job Corps and it was a safety issue, then we could maybe look at that for good cause if it's a true safety issue. But for the most part, the federal regs are pretty firm that we do need to be cost avoiding.
Great questions, you guys. We will go ahead and continue sending in your questions. Let's talk about when TPL information should be reported. So as we talked about earlier, you're reporting TPL information both when applying for OHP as well as when renewing. Whenever there is new TPL, so even if it's in the middle of the coverage period, if someone in the household becomes eligible for employer-sponsored insurance, for example, that would need to be reported. And they're going to want to report that again to both 5503 through the application, or community partners can help folks report that new coverage, and as well, best practices to report it through the web form as well. When a TPL policy changes, when it ends, when a policyholder wants to apply for premium reimbursement, again, we'll talk about the HIP program in a little bit. And who can report this information? So ultimately, the individual is responsible for reporting anything to do with their TPL changes, start, end, etc. Providers and coordinated care organizations, as well as DHA and OHA staff.
And I have to tell you, too, our largest group of reporters, frankly, are the CCOs. We get a lot of referrals in. HIG gets usually 300 to 400 a day. and both of them are coming from CCOs and providers, and we're so grateful for that. And I think because clients go in to get services, and they walk up to that receptionist counter, and the receptionist says, "How are you paying?" And they just, going to put all their cards on the table because they don't want to pay. So they're more likely to tell the providers and the CCOs about that insurance. Actually, they tell the providers tell the CCOs, but nevertheless, that's where the bulk of them come from. But we've seen a very sharp increase on clients that are reporting actually through the web form. So through our assisters and the phone bank call center at 5503, I'm really quite pleased to see how many clients are actually now reporting. So everybody's doing a really great job of getting them over to that web form, and we really appreciate that.
Great. And who also can help report TPL information are community partners or application assisters, we know, who are assisting individuals who have TPL. And then, of course, authorized representatives or others assisting clients can also help report that information. So we've talked a little bit about this already, but TPL information is collected on the OHP application. And this includes the One Applicant Portal, paper PDF applications, and over the phone as well with OHP customer support at branch 5503, and also through reporttpl.org, so the online web form. Once again, the OHP application collects some of the needed TPL information, but it doesn't quite capture all of that needed information, which is why we are continuing to refer applicants to reporttpl.org as well. Okay, so we'll take another moment here before we switch gears and take a peek at our questions. You guys are asking lots of great questions.
Sure are.
So Erin, I can take this one. What is the point of having a question on the TPL form asking about safety if we have to then go and request in a different place? It is already collected on the application. So if they have benefits, OHP, then that question should have been already asked on the application. So we are already collecting that. And maybe you wanted to chime in as well.
Yes, and Erin, the reality of it is that you should not make the assumption about any part of the application really that because something is reported there that it's automatically going to get over to the entity that actually does the part of the business that causes that good cause to be activated in MMIS. There is not a process. Most of these applications are done either through the federal hub and it's all electronic, or it's the paper applications maybe are done, or the applicant portal, but there's no good mechanism right now that gets that information over to HIG. The other thing is that with delays in processing of applications, it could take a while if HIG did learn about it through the application process. There could be a lengthy delay before that would even get, the application would get worked or HIG would actually get it done. So that's usually with safety, that's something that requires a really pretty expeditious action. And so you want to maybe take, I know that it's an extra step, but you may want to just take that extra step of contacting 5503 or somehow getting the word over through to HIG that that's the case, that needs to happen, so that it doesn't, there's not unnecessary delays. We still have some challenges in that area of being able to communicate TPL information through the various ways that people apply and ultimately having it get at HIG. That's, I think, the fact that the bulk of our referrals come from CCOs and providers kind of indicates that we still have some challenges in that area. So I know that it's extra issue to have to do that, and I certainly understand your concern. I've had concerns about that myself. So just taking that extra step to make sure that HIG learns about it through a branch office helps make that go faster. I don't know, Colette, if you want to add anything on that.
Yeah, I mean, I think, like Carolyn said, we're definitely aware that having to report this information more than one place is, you know, can be
not ideal.
Yeah, not ideal. Yes, and is something that we're aware of and hope to improve in the future. But for now, especially, you know, if there's safety concerns, we do want to do due diligence to make sure all parties are aware of, for instance, safety concerns, so that we can get that taken care of.
And Erin, let me add this piece for you too that might be helpful. So right now, OPAR and myself and some of our managers there, the lead workers in HIG, we've actually been in regular meetings with 5503 for quite some time to talk through a couple of areas that we have to work through. One of the biggest one really is the good cause. Good cause through the web portal, applicant portal, will cause a queue to be created, but we've had trouble working that queue because if the TPL information isn't completely provided, we don't know what TPL we're supposed to go and put the good cause indicator on. Some of these families, it's one parent's insurance that's the problem, but not both parents' insurance. So we have to put on the one that is safe to pursue and not put on the other. But if we haven't been given enough information, we can't even work that good cause queue that's created through the one system. So please, I don't know if it's any comfort to you, but please know that it's not something we're turning a blind eye to. It's a high priority. It's being discussed a lot, and we're trying to find a good workable solution for everyone. In the meantime, we got to keep the client safe, and making sure the HIG gets the information is the best way to do that.
And we have some more questions coming in from Alex about Job Corps. Again, students with private insurance. Most of these students don't have we talked about that, hold on. We often have a difficulty getting even the name of the insurance. What's the best way to handle this? For the most part, parents aren't willing to help.
That's a difficult one. We're required to do every effort we can to find that insurance. I mean, the reality is, if they don't provide it, they don't provide it. And children, if they're under the age of 18, can't be penalized because the parents don't provide it. So the way the regulations work right now, if we have a failure to cooperate, we can take Medicaid away from adults, but we cannot take it away from children. So I would say do the best that you can to try and get it. If you can't get it, then we're not going to really have much recourse in that situation anyway. Hopefully, if it came up in an audit or by Secretary of State or PERM or CMS, it's nothing else. It would be good to have us have some narration in on the case through either through one or tracks or the Oregon Access that would say why it wasn't there.
Great questions, you guys.
Yeah, fantastic questions.
From Linda, why does the state retro newborns to plans such as Willamette Valley Community Health, so like CCOs you're saying, then when we have to try to get payment from them only to find that we are not listed as the PCP?
So that's a question that really needs to go to OHA, to one of the account reps over there. I can tell you this, that because the mother is pregnant, there is assumed eligibility for the baby, and because there's assumed eligibility for the window of time, I think it's a year still, that baby has assumed eligibility once it's born, that's why it's retroed back into the CCO. If you're having issues with the CCO, then you can certainly contact the CCO. If you're having difficulties that are not being able to be resolved by the CCO, then I would contact one of the account reps at OHA.
And you can work through your regional outreach coordinator or through me to get connected.
Absolutely.
And then we have our Lane County folks are working to clarify their questions. Thanks you guys. So you're stating Erin's question was regarding the report TPL TPL.org website. There's a question regarding not being able to use the insurance on this website, and then your instructions on the webinar say to call the branch and ask for good cause. And on the quick reference guide it says notify HIG.
Okay, well that doesn't sound so good, does it? So I'll take a look at that, Susan, and see if we can't pull that. It sounds like we've got some inconsistencies there. I appreciate that heads up. We'll take a look at that.
Thank you. And then, so if the doctor's office notices that there is TPL and submits to reporttpl.org, and there is safety issues, but the office is unaware of the safety issue, does the new submission of TPL deactivate the safety concern that is on file?
So if we already have good cause on the case and you report new TPL, we're going to leave the good cause on. We don't take that off until we're asked to. And the fact that you check don't know on that box does not make us take it off. So from a provider perspective, we added that don't know because some people just don't know. If you don't, then just mark it as don't know, and when we see it, if it's in there, we're going to let status quo stay. We'll update the policy to see if anything has changed on it, but the good cause will remain.
And then from Rachel, as a provider, is our agency required to report TPL?
Providers are required to report, so I would say yes, you are.
That's a simple answer. Thank you. All right, you guys, we're going to go ahead and move forward. Great questions.
These are fantastic questions. I love it.
All right, so jumping into the online web form, reporttpl.org, first addressing why HIG moved to an internet-based TPL reporting tool.
So back in the day, everybody reported on paper. And again, going back to my start with the state of Oregon, and the comment I made earlier about, oh, if you don't have it, HIG will find it. What that ended up eventually causing is when ACA implemented, HIG literally had in one cubicle, one empty cubicle, in buckets and boxes on the desk and on the floor, 40,000 pieces of paper that we had not been able to process because they didn't have enough information. So we had to get out of that. That was, some of you who've been around a while may remember, that was back in the day when HIG was a year out on processing, and it was dark time for all of us. So we really needed to find a way that would get us the information that we needed so that we could quickly and efficiently process those referrals. We call them referrals, notifications, whatever word you want to use, so that we could get MMIS updated correctly. It's important to providers, it's important to clients and the CCOs, and it's just a necessary part of the Medicaid process that MMIS be accurate. So those paper forms were just way too labor intensive. We would have people sending in things. Once, this is really the truth, a 415H was sent in, and written sideways through the form was, John doesn't have insurance anymore. And that was all there was. No last name, no case number. We didn't even know who sent it, so we couldn't even contact them to say, who's John? John who? Mm-hmm. So we knew we needed to have a better way to do it. We needed more information, we needed a better process, and we needed to be able to get back to the submitter if something wasn't right, so that we could say, you know, Colette, you said John doesn't have insurance. John who? Give us his prime number, give us his last name. And so we really had to find a better way. We did some research, and we found a vendor who already contracts, who has a master contract with DAS, and we went through the process to do the online web form. And I have to tell you, it has been an absolute paradigm shift. Because of that form and all of the efforts that all of you have made to use it, to transition over to it, and to submit it, HIG is only about 10 days out in processing now. And it's very rare for us to get something that we can't work because it's incomplete. So huge, huge paradigm shift in how we do our business. And so that's why we moved to the internet-based form. the value of it is pretty, I think, clear to think about. It's easy to complete. Once you have done it once or twice, you know exactly what's coming. You can just, we tried to make it check boxes and not a whole lot of data entry. We only asked for information that was mandatory to process the form. We gave you drop-down menus and radio buttons to be able to answer a lot of the questions. We wanted you to have a record, too, of what you sent in. With the paper 415H, that wasn't always the case. So at the end of the form, the submitter can print a summary page of exactly what they sent, which is good for providers and CCOs especially, because then they can follow up to see when the change has been done if they want to. Another really important part about this form that we really love is that the submitter gets an email automatically with a confirmation number. That's why we ask for an email on that very first submitter page. You get that confirmation number so that if you have some period of time goes by and you need to have us say, oh gosh, I didn't know there was good cause and there is, can you add that? You can give us that confirmation number or some client information and we can very, very quickly find it. Back in the day of the 40,000 in the cubicle, if someone called to say, hey, I sent this in, can you tell me what's going on with it? Quite frankly, we had to say, well, no, not really, because we can't go dig through 40,000 pieces of paper. So the client or the individual would have to just give us the information again. So now with that confirmation number and that email, we can find something in literally seconds. So it's been a process that's helping you get information to us in a way that we can take care of what you need in a very quick and easy way. So where do you find the web form? One of the other things that we thought was important was we didn't want you to have to go looking for some crazy URL. And our fantastic administrator let us purchase a vanity URL, and that is the reporttpl.org. Easy to remember. And when you go to that site, it takes you to the main web page, which gives you some instructions on, what you need to report and what kinds of things you need to report, and a little bit about the Premium Assistance Program. But there at the top is the Submit button. So once you're ready to go, you just click that button and it actually launches the form. We've also got some contact information on the page as well. I think we cover this a little bit later in the webinar, but just want to tell you that HIG is a production environment, and we are resources to DHS and OHA for the most part. And we do ask that you not send clients to us. Not that we don't want to talk to clients, but we are your resource and you are their resource. We have one phone line, one person that answers it. And so we just logistically, it's very difficult for us to take a large influx of client calls. So anytime that you can resolve something, and we have a resource page for you at the end of the PowerPoint that will give you some guidance on where to call if you need some help. So once you click Start or click the Submit, it takes you into the web form. And I'm not going to spend a ton of time on each slide, but I just want to give you some insights into filling out the form. I think most of the world right now probably has a newer browser. This form does not work well if you're using Windows 5, 6, 7, or 8. So it does require that you have a little bit of a newer browser. Usually Chrome and Firefox work really well. Internet Explorer is the only one where we really have some challenges, and it was with those versions that are 8 or lower. How you can tell if you've got an older browser is in that upper left-hand corner of the form, the slide you're looking at right now, where the Oregon.gov and the tree is. If you can see that, you're good to go. If you don't see that, you're on an old browser. We want you to not use this form if you have a rush request. Sometimes, and I'm specifically talking to the assisters now, more so than the providers, HIG has we work everything in the order that it's received, and that's fair to everyone. first in, first out. However, there are certain times, like right now, if we've got 500 in the queue and we have a client that's at a pharmacy and they need their medications right now, we don't want someone to not get their heart meds because HIG is 5 or 10 days out in processing. So we do have the ability to fast track one and to work it more quickly. We don't want you to send rush requests in on the web form because while we have a real-time way of getting the stuff that's sent in on the notifications that is sent in on the web form, mostly our person who retrieves the files and gets them into the HIG work queue doesn't even receive it from the vendor until the next day. So if you have a rush request, we want you to use the rush request process, which is on one of the extra documents that Colette provided for you. There is a
I think it's the HIG quick reference guide.
Yeah, the HIG quick reference guide does have rush request instructions on there. So you can technically send one this way, but to me, rush means someone has been denied medication or emergency treatment, and that really shouldn't be stuck in a queue somewhere. So please look at that quick reference guide for instructions on the rushing process. Okay, so once you get into the actual form itself, it's going to ask you some basic information. We've got a drop-down menu there for the top 10 or so payers in Oregon, but literally I was shocked to learn in Oregon we have thousands of insurance companies that our people are covered by. You go to Tennessee and Alabama and there's like one, but here there's literally thousands of them. So we've given you the primary ones in the drop down. If you don't see it, another box or other option is there, and then you can just type in the name of the insurance company.
You know what, Carolyn, this one is just asking for who's reporting right here for this drop-down menu.
My bad, I've skipped ahead, guys, so sorry about that. This is actually the submitter page, so my apologies for that. Yeah, this is asking who are you. This helps us to know who we're working with if we have to contact someone, so you just use the drop-down. The business name only appears if a CCO is selected. And once you fill that out, and again, the email address is critical because that's where the confirmation email is going to go. So for people who are helping clients fill out the application, if you're doing this web form for them, you may want to have that conversation with them about whose email do you want me to put there. Do you want that confirmation email to come to me, or do you want me to put your email in so that you get it so that you know that it was submitted? Either way is okay with us, but keep in mind the whole sole purpose of that field is where should the confirmation email go. Thank you for catching me on that. Okay, this is the dashboard, and when you get to the dashboard, literally all you're going to do here to get started is you're going to click that add button, that blue button there at the top. If you're ending one policy and starting another one, and that happens, these people are so fluid, it's surprising, and they change insurance companies all the time, primarily because employers do. So it doesn't matter if you give us the terminated one first or the new one first. It makes no difference, but this is where you start the process. So you just click that little button, and that takes you into where I was speaking earlier about the names of the insurance companies. So we're giving you the top 10, and then you just sort of move on down the form. I think we could probably go to the next one. So as I said earlier, with terminated policies, if you're reporting one of those, you really don't have to know the exact date, but try to get us in the right year, or the right decade would even be good. But get us as close as you can. Does not have to be exact. We do ask you where it came from, and partly that's because we have some different pay and chase regulations around absent parent insurance, and the insurance from an employer helps us to kind of see if we can get somebody qualified or get someone up to apply for the HIP program. Down at the bottom, we ask you to tell us as many of the different types of coverages that this applies to. So I think that's good for that page. Here's where we ask for that Social Security number and that date of birth. And again, this goes to what we said earlier about Social Security number. If you've got it, please, please give it to us, because now you know what obstacles we face trying to get that. HIG will do whatever research is necessary if we have to, but sometimes that research, you may be surprised to know right now it takes about 30 to 45 minutes for one worker to process one notification. And in an 8-hour day, that doesn't mean you can get very many done. So if you're having to spend an extra hour or two looking for Social Security numbers, that's one less referral that you're able to process, and slows it down for someone else who's waiting. I think that's probably good for that page. So here is where you go in and add dependents, domestic violence, and good cause. There's this button up there at the top. You can click to add people. A little window will open. It's called a modal. And in that modal is where you can put in the people that are covered by the policy. Take a note here that if you have a client that's the policyholder, and then you get to here, you're going to have to add that. If the policyholder is covered by the insurance, you're going to have to add them as one of the covered people. Not all policyholders are covered on the policy. They may be providing insurance for a child and they're not covered at all. So if the policyholder is also covered, you would have to go ahead and add them in as a covered dependent plus a spouse, children, whoever else that insurance covers. I think that's pretty good for that one. Recipient ID is an optional field in the modals. Not providers don't always have that, and depending on who's filling out the form, maybe even the client hasn't been issued one yet if you're trying to send this in advance, which we didn't add as a FAQ. Mm-hmm. You could report TPL in advance of someone being approved for Medicaid. Not necessarily advisable, because if we work it and we don't see any eligibility, we're going to just move on. So you may want to hold off filling this out until after the eligibility has been done, or give it a couple of days or something. I don't know. Just something to think about there. Okay, I think that's probably good for that area.
And then those additional questions are just asking about safety
concerns.
Safety
and good cause.
Mm-hmm.
Yeah, and again, if you're not sure about the safety and the distance, just click don't know. And you can write, we gave the comments boxes there, or the one that's coming up. You can always tell us any piece of information that you think would be important for us to know.
Mm-hmm. And then the second one asks if there are any other reasons other than safety concerns that would prevent them from using this insurance. So
that's where you would mark the distance. That's the Kaiser Permanente example. Not only that example, but sure. Sometimes we have people who are children who are adopted, and the bio parent is the one who has the TPL, but it hasn't been through the courts or whatever, it hasn't been changed yet. Mm-hmm. So in a bio parent adoptee situation, we can put good cause on to not pursue that insurance as well. Okay, sometimes people get really, this form has been such a hit, everybody just really wants to use it, and so people from multiple places will actually try to submit the same person. So we do have duplicate functionality in there, so if certain key pieces come in on the exact same client, especially from the same person, you'll get this warning that'll say, basically, we think you've already submitted this, or this has already been submitted. Are you sure you want to continue to do it? At this point, you can decide whether, oh, yeah, I already did that, so I'll just cancel out of here. Or maybe you're needing to make a change. You forgot to add someone the last time you submitted. Maybe you submitted it and then went, oh, darn, I forgot to put the wife or the husband on. So this is just a decision point for you to decide whether or not you want to move forward or whether you're not needing to. This is the general comments and the document upload section. And in the beginning, we had people who had a little bit of trouble with this area because down at the bottom, you've got that green Save and Continue button. So up at the top, general comments, again, tell your story if you have one. If you don't have one, not necessary. It's an optional field that's just there in case there's something you think you especially need to tell us. The upload field there would be, or the upload option would be if you wanted to send us insurance cards, not required, but terribly helpful if you have them. And you could just scan that from your phone or on your computer, however you want to do it, and then upload that. If you have them and have the technology available to be able to include it, it always helps us. But again, that's not mandatory. The Save and Continue button, in the beginning, people would go, well, it's not letting me move forward. I'm clicking, and nothing is happening. Usually, if they get in that situation, it's because you've left a mandatory field. You skipped a mandatory field. So just scroll back up the page. If you've missed a mandatory area, it will highlight in red, and then you can go in and fill out that particular section, and then go back down to the Save and Continue button, and it will let you move forward. So I've never had an issue reported in 3 years with that Save and Continue button that was not associated with missing a mandatory field. Okay. So now after you do that, you're back at the dashboard, and here it's going to show you what you've already entered. If you had that second or third policy that you needed to enter, you just click the blue button and go right back through that same process again. And you might be surprised to know, our people are really covered by a lot of insurance. It's not uncommon for someone to have multiple types of insurances that they're covered by. Mom might work, dad might be in the military and have the TRICARE. So it's very common for many of these people to have more than, or many of our clients to have more than one insurance policy. So, and again, it doesn't matter what order you do them, so long as you get them in.
So before we jump into the health insurance premium program application section, we'll go back to the question box and see what we have coming in. Okay, do you use an http://www in front of reporttpl.org?
That's a good question. I honestly think, Paul, it depends on what computer you're on. I've had it work both ways. Sometimes I'll just put reporttpl.org in a browser and it'll go right to where it needs to. And other days, and other computers, it's having some attitude and it wants 3 W's. So I would say whatever device you primarily use, try it once without it, just the reporttpl.org, and see what result you get. And if you can get by without it, you just saved a few keystrokes. One thing I didn't tell you too, that web form one of the great things about it is it can be accessed from any device that has internet. You can submit on a telephone, you can submit on a laptop, a tablet, or a tower. So whatever, any electronic device that's connected to the internet can submit that on that form. Mm-hmm. So try it, Paul, and see how it goes.
A question from Mark. Since one and paper applications don't collect enough information for HIG to add TPL to the database, first sub-question, why is this information collected at all by one or paper app if it's not useful? And Mark, I can help address that. It is useful. TPL information and other health insurance information in general is information we have to ask, and it does in many cases affect eligibility. So that's why the information is asked for on the application. And then the second part of your question, if there's not enough info collected, why not do that very thing, modify one and paper app to collect enough information to process? Well, that seems like a very logical suggestion, Mark.
So Mark gets the good question of the day award, not that the other questions weren't good too. But let me just say this about your great questions, Mark. So as Colette said, we are federally required to ask that on the form. When ACA implemented, the priority is on eligibility, not on pursuit of payment. And so what is supposed to happen is right now, whatever information does come across on the application, if it's not sufficient to process, then the DHS or OHA worker is supposed to tend the client for the missing pieces. Once those missing pieces come in, then that worker should forward it over to the health insurance group or complete the web form. So we get what we can based on what the federal application process allows us to get, and then we have to supplement to try and go get the missing pieces. That's just it. I mean, that's the reality of it. That starts at the federal level. And as far as modifying one, you'll be happy to know that there are things that are being done right now with change requests with one, and also to look at the pending process to try to figure out a better way for us to be able to collect that information. Again, this goes to what I said earlier, and it's part of the meeting that I have this afternoon, is we're working to try to find ways to fix the holes. One of that includes, I've been part of a national work group through the National TPL Tag, and we are working with CMS right now as we speak, and they're trying to make some modifications with the application itself at the federal level. So I'm excited about that. These things don't go particularly quickly, and so we're just trying to work through these issues as we've identified them and find the resources and the ways to fix it as we can. So hopefully next year we'll see some relief in that area. And in the meantime, we just are doing what we need to do to be able to make the business work.
How long after reporting TPL changes can we expect to see the change reflected in MMIS?
Connor, I'd say right now about 10 days, definitely less than 30. We get a report from Deloitte on the people who did not submit enough information, and that is a quite large file right now, and it's being worked by a vendor. And what we're seeing is there has been a huge spike in clients who've been reporting. So normally where we may only have a few hundred in the work queue, right now we have about 1,000. And that's just been in the last 2 weeks because of the work that the vendor is doing to try to clean up some outdated info. So I would say you could really, about 10 days to a week, you should definitely see something in less than that.
Many times when I report the end of TPL and start a new one, only one part of the request gets done. Do you suggest doing 2 different requests? Many times one TPL is ended, the client gets enrolled into their CCO, then I decide to submit another request with their new information again.
Okay, that doesn't sound right to me, Susan. HIG works whatever comes in on that form. So if you're sending it and saying one part of the, like one started and one stopped, and that one that stopped didn't really get done, in my head, I'm thinking that when HIG did the verification, the one that you think or the client thought stopped hadn't really stopped. And that happens a lot. The way the insurance industry works, insurance doesn't necessarily end. I'm getting close to retirement, and I just had this conversation with the TED people about 2 weeks ago. When does my insurance stop? On the day that I stop working? No, it doesn't. I have another 30 days of coverage. So that's generally how insurance works. Now, I'm not saying that's necessarily what happened in your situation, but I think I want to look into that. Let's do this, Susan. If you see that happens again, email me, and you might contact info at the end of the presentation. You email me with the confirmation number that you got. And then I can go in and look and see, and then you may even already have one that you could send to me. If you can give me an example to look at, I can find out what happened and make sure that we didn't have a system problem.
Thank you. So guys, we will jump back into questions, but for the sake of time, we have about 20 minutes left. I want to make sure we get through the rest of the presentation, and then with time at the end, we'll continue to look at questions, and if not, we'll follow up by email.
Okay, you guys have got some great questions here, so I want to make sure that we have plenty of time for that. So I'm not going to spend a whole ton of time on HIP, but I'll let you know this, that through the Social Security Act, we have the ability to reimburse policyholders for the premiums that they pay for their insurance. And that might be employer insurance that they have deducted from their paycheck, and that might be they bought a policy on the internet and they're paying premiums for that. Back in the day, it was hard to qualify for this. Today, it's not. The program's been redesigned, and we are able to pay, it's really reimbursed premiums for the majority of the applicants that we get. There are some requirements to have to qualify for this, like we don't reimburse for Medicare, and we don't reimburse for standalone policies, but all of those type 1 major medical policies, we have the ability to pay that, give people that money back. So even for state, we have state workers on Medicaid, and that money that we have as a state worker deducted from our check, we can reimburse for that. We have people on COBRA that are being charged $1,500 a month for their COBRA. We may have the ability to reimburse for that. And for a lot of these folks, the average HIP payment is about $350 a month. That is groceries, that's a utility bill, that's a really important return of money back into their household. So you can go to our HIP webpage. It's OregonHIP.org. This is what it looks like. We give you some information about HIP on here, and then you can actually apply for it. And when you apply for HIP, it takes you into the web form. Now, had you been just moseying along through the form submitting, and many of you who have used this know that you come to this page. And it asks a question, does the policyholder, that's important, policyholder pay for all or part of the premium? Yes, no, and don't know. If you mark yes, it will open up some additional boxes where we collect some more information about HIP. I will give you a heads up, those of you that are doing this, is we submitted a change request to extend the type of questions that we ask. That is supposed to go into production in the next couple of weeks. So you may see that when you mark yes, different questions will appear. The reason for that is we did not, when we first implemented this, we didn't ask enough questions. And we've been having to send out supplemental paper documents to people to complete. We want to get away from doing that and try to get it all here in one shot. So once they ask the additional questions, and I think Colette, we can just go ahead and go through. We're going to ask how much it costs and when is it deducted. We ask if there's any medical conditions. We have the ability to more easily qualify someone if they're pregnant, if they have cancer, if they have diabetes. We have a very long list of diagnosis codes and special conditions that if somebody has that, we have a greater chance of getting them qualified. And again, it's pretty easy to qualify anyway. Just a heads up, but one thing that I love about this program is that if mom and dad and the 3 kids have private health insurance, but only the kids have Medicaid, oftentimes, because of the way the program works, we can reimburse the premiums for mom and dad's work insurance too, even though they're not on Medicaid. So this is definitely something who has other insurance. I think they all should be applying for it myself if they meet the criteria, not Medicare and that sort of thing. And all of that's listed on the website. I don't think we necessarily need to show all of these screens. These are just, again, more of the types of things that we ask. We ask if that insurance is court ordered, because if a judge has ordered insurance, it means that the judge wants that policyholder to be providing that insurance, not the state of Oregon. So that is one of the criteria that if you check that box, you're not going to be eligible. We have a spot here where you can upload check stubs. Again, if you don't give proof of the cost, either through a check stub or through a billing statement, if it was commercial insurance that you've purchased, we're going to have to ask you for it. So the more that you can give at the time that you apply, the faster that can go. Checks only, once approved, we do not retro back. We get that question a lot. We don't retro back. We start it, the payment, the month after it's determined, the month after it's approved. So the sooner they apply, the better for them as far as getting that reimbursement. And again, if policyholder doesn't live in the household, we're not going to give the check to the caregiver. It only goes to the policyholder themselves. So once you get that done, you're almost finished. You're going to get a review page that you can look at and then decide from the review page if you need to go in and make any edits or not. If you don't, you just click that little box down there at the bottom that says by submitting, I'm good to go. And then once you do that, it takes you to the I'm done page. Here you can see down in that lower right hand corner, literally you're going to get a notification of that confirmation email within like seconds, like a nanosecond almost. It pops right up. And that lets you know, once you see that confirmation email, HIG got it. No questions about it. That has been submitted. That is not floating somewhere. It's in HIG's work queue. So that's your good to go acknowledgement. If you want to print it or save it, you just click the little print or save button, and that will open up a print box on your computer, and you can decide whether or not, I think that's probably on that next slide, Colette. It looks something similar to this depending on your computer, but it gives you the option. You want to select from your print option box there the PDF creator or the Adobe PDF or whatever it is that your computer has for saving a document, and then save it on your computer. And then you've got a record of what you submitted. That review page has everything on it that you entered.
And for assisters, if you are assisting folks through this process, this would be one of those documents that would be good to keep a record of. And also, of course, you would want to store it securely, so on a password protected file, for example, or if you were to print a copy in a locked and secured location.
So troubleshooting, not too many things should be going wrong for you right now. If you've got the right browser, you should be okay. I will tell you that this web form does cache pretty easily on your computer. So if you should, by some chance, get an error message, clear your cache, try to submit again. That has happened a few times, but not very often. I think it's just sunspots in the internet at the time you submit, but clearing your cache is always something you may want to consider. If you can't move to the next step, it's usually because you missed something that I spoke about earlier. If documents won't upload, it could be the document type that you're trying to do, but again, don't not submit because a document wouldn't upload. That is an optional feature. If we need something, we'll ask you, but again, just go ahead and if it works, great. If it doesn't, well, that's okay too.
All right, so we're going to jump into frequently asked questions. The first is, what happens if TPL information is reported in one or on a paper printed PDF application, but not reported through reporttpl.org?
So we cannot mandate that anybody use TPL.org. You don't have to use it. You can just put it on the application if you want and hope for the best. I tell people that if you really want to be sure that HIG gets the TPL, the extra step of going to the web form will seal the deal. That's the best way to know that we got it. Based on the way one works, and the federal hub is very problematic for us. It sends us information but doesn't always give us the name of the insurance company, even though it's collected. So can't make you do it, can't make a client do it, but it's the best practice you can have to make sure that that information gets to you.
And it avoids a lot of the follow-up, the back and forth between the client that would otherwise happen in most cases.
Yes, absolutely. Good point. Thank you.
And what happens if an OHP member has TPL and does not report it?
Huge problem for providers, because if a provider bills thinking it's fee for service and then we later add the TPL in, the provider has lost the opportunity to get the TPL rate from the insurance, from the TPL payer, which is, I think, a disservice to them. It causes lots of claims payment issues. If TPL is on and they haven't reported that it's not active anymore, they could get denied at the pharmacy, and that happens a lot. Most of our rush requests are because someone has failed to report and now they're trying to use their service, and what MMIS is showing and what the client is saying don't match. And then that requires lots of intervention and steps. A lot of people can get pulled in to try to clean that up. So best practice, they need to report it when it changes.
Can a client end their TPL if they are approved for OHP?
Not really. We're seeing a big upswing in this right now, especially with people who are qualifying and it's open enrollment time, and so they're thinking, why should I apply for that when I've got OHP now? And what clients need to know is they are mandated to provide or to pursue resources that are cost effective. And one of those resources is health insurance if it's cost effective. And if they don't take it, they are at risk of having the adults on the case lose their Medicaid, and now they're in a pickle because they have no insurance. So if it's offered to them and it's cost effective, they're required to take it. How it's determined cost effective is whether or not they apply for HIP. Most insurance is cost effective these days. So if they're interested in finding out if it would be cost effective for them to pursue, the HIP email address is at the end of the presentation here, and they could always send an email over, and one of the premium reimbursement coordinators could check for them. But I have to tell you, we have to make referrals all the time for people who've canceled their insurance because they thought they didn't have to, and now they're losing the benefits. So not the children. Children are protected, but not the adults.
And it's important to note, too, that if the coverage is deemed not cost effective, they are not required to take that coverage.
Exactly.
So if they've listed it, they've done their due diligence, they've pursued it, and they've applied for HIP, and they've been denied for HIP, then they've pursued that resource at that point, and they wouldn't have to take it if they couldn't afford it out of pocket.
Yes, and then they could drop their insurance.
And also, just to squeeze in there, as a reminder, at the CHIP level for children, you are not able to have other major medical coverage, i.e. TPL, and OHP at the same time. So households between 138 to 305% with children typically are not able to have other health coverage, other TPL, as well as CHIP, OHP. So just a reminder as we talk through this. What should I do if a client asks if they can end their work insurance because they qualify for OHP now?
I would refer them over to the Oregon HIP page and have them apply for HIP. Let's see first if they don't qualify for HIP, and if they don't, as Colette said, then they've done their due diligence and they don't have to take it, or they can go ahead and end it if they want to. But I just hate seeing a client get in that position where they say, I don't want it anymore, I don't need it, they turn it off, and then they end up with no coverage because they've not pursued the resource.
And we should also state that if their employer offers coverage, but they're applying outside of the open enrollment for their employer, they're not required to, that's not a barrier. It's just once that coverage becomes available again to them, they have to report that.
And once they're already on it, they need to make sure that they don't qualify for HIP before they try to stop that insurance. So they shouldn't just decide not to take it. That's the people that mostly get in trouble, are the ones that are already on the employer insurance, and then they decide to go off because they have OHP. So kind of a catch-22 there that's a little bit tricky.
Can clients with TPL or good cause be enrolled in a CCO?
At this time, no, they can't. And that we talked about that a little bit earlier.
We did. How long does it take HIG to process the work they get on the web form?
So I think we've already covered this as well. I think 10 days is a good rule of thumb. So you can certainly check in the web portal, or whatever sources are available, resources available to you, to see if it's been done. But I'd give it about 10 days.
What should I do if my client has been denied eligibility for CHIP because MMIS is still showing active TPL that has actually terminated?
You need to report that TPL change as quickly as you can on the web form. And as soon as it gets that processed and that TPL has been ended, then the client can go ahead and reapply.
So we have some resources here on the page for you guys. As we mentioned, HIG is primarily a resource to OHA and DHS, a small unit with one phone line and limited staff. So following guidance, please use it. I'll let you take the top part.
Yeah, you can just go ahead, we've got the email address on there to email HIG for any of our OHA, DHS staff community partners. Phone number is on there, that's for internal staff only. We've got, I've got my name and my email and phone number there if you're having functionality issues with the web form. And then clients, you've got the 5503 call center number on there, the 2 website addresses, and then the email box if you have a question about HIP or you need to check on follow up on an application. clients can definitely contact and use that reimbursements.hip email box. That's kind of for everybody, so no problem there.
And then all other questions from our provider partners, our community partners, you can email your ROC or you can email me, the provider campaign coordinator, Colette. You have my contact information up there. We are just about out of time, and I know we still had some questions coming in.
We've got a couple of
Let's
short ones
see if
here.
we can't answer a couple short ones. Thank you, Carolyn.
Often get errors when trying to submit after clicking a box that you agree to. Okay, so Tori, if you get those error messages, clear your cache, see if you still get it. If you've done that a couple of times, cleared your cache, and you're still getting that error message, take a screenshot of the error message and email it to me, and I will send it to the vendor. Would it be possible to insert the reporting.org programming into the one program? No, Mark, we cannot put that in there. I've been trying to do that for 2 years, and they're not. They've got a lot of reasons why that won't work. So I wish we could, but apparently, according to Deloitte, no, that can't be done. Thank you. Oh, well, thank you again, Mark. I'm glad we were able to answer your questions and provide some information. Is there an income guideline for HIP premium? Yes, there is an income guideline. We don't publish it on purpose. We don't want people to self-select out. There's complexities in how we apply that information, and the best thing to do is just apply. I mean, just have them apply, and then we can see if they're qualified. But too many people would be saying, oh, I don't qualify because they don't understand how the calculations work.
And then what happens if a parent does not inform us of other insurance and later DHS finds it and retros coverage? Now Medicaid is taking money back, but the claim is now too old for us to bill the insurance that they failed to report to the state and us. Can we bill the parent?
So no, Linda, you can't bill the parent in most cases. I will tell you that MMIS is a brilliant machine, and we really, if a provider has paid, we have a unit at OPAR, the Medical Payment Recovery Unit, that goes in and recovers the Medicaid allowable from the TPL. So if you've had money taken back from you or your business, something else is going on. It may have been a SMAP, which is a action that DMAP or OHA will sometimes take. But for the most part, we know that you have timely filing limits, and we don't want the providers to not be paid. So if you have an issue where that has happened, go to the OPAR website, look up Medical Payment Recovery Unit, and contact them, and they can look at your claim and let you know. Well, actually, you probably should call provider services and check with them first. And if they can't resolve your issue, then you can come to Medical Payment Recovery, and we'll take a look at the claim for you. But as a rule, we don't take money back from providers unless it's Medicare related. So that hopefully will answer your question, Linda, and give you some place to go to get that claim checked.
And Linda, let me know if you don't have the information for Provider Services Unit, and I can get that for you. That's Colette. All right, that was our last question. We're finishing right on time. We will scour through and see if we missed anything, and then follow up via email. You have a copy of the presentation. You have both Carolyn and I's contact information, so please reach out if you have questions. Thank you guys so much for your participation. This was a really full presentation. Thank you so much, Carolyn, our expert, for walking us through all of this. And again, please reach out if you have additional questions. Thank you guys so much for your time today.
Thank you. We appreciate all you do.